Palindromic rheumatism, PR, is a condition where a person gets sudden short-lasting attacks of joint pain and swelling. Each attack usually lasts a few hours to a few days, then disappears completely, only to come back later, often in a different joint. Think of it like a flashing warning light on a car that turns on briefly and then goes off, but the light can appear again at any time. The exact cause of PR is not known, but doctors think it is a mix of genetics and the immune system acting wrongly. Some people have family members with rheumatoid arthritis or other autoimmune diseases, suggesting a genetic link. The immune system may mistakenly attack joint tissue, causing the brief inflammation. Imagine a security guard who sometimes mistakes a harmless visitor for a thief and briefly sounds the alarm. During an attack, a person feels sharp pain, warmth, and swelling in one or more joints, often the fingers, wrists, knees, or elbows. The joint may look red and feel stiff, but the symptoms fade completely after a short time. Between attacks, the person feels completely normal with no lingering pain or damage. For example, a person might wake up with a swollen finger that feels like a small balloon, but by evening the finger is back to normal. Doctors diagnose PR by looking at the pattern of short recurring joint attacks and ruling out other diseases. Blood tests may show markers of inflammation, like ESR or CRP, and sometimes rheumatoid factor or anti-CCP antibodies, which suggest a link to rheumatoid arthritis. Imaging, X-ray, or ultrasound usually looks normal because the inflammation does not stay long enough to cause damage. Treatment aims to stop attacks. Non-steroidal anti-inflammatory drugs, NSAIDs, for quick relief, low-dose colchicine, or short courses of steroids. If attacks are frequent, doctors may start disease-modifying drugs, such as methotrexate, to prevent progression to chronic arthritis. An interactive example, think of using a fire extinguisher, NSAID, each time a small flame appears, versus installing a sprinkler system, DMARD, to stop any future flames. Because PR is linked to the immune system, there is no guaranteed way to prevent it. However, staying healthy can lower the chance of flare-ups. Keep a balanced diet, maintain a healthy weight, exercise regularly to keep joints flexible, avoid smoking, and manage stress. If you notice a pattern like attacks after heavy manual work, try to modify that activity as a practical prevention step. Recent research shows that many people with PR develop rheumatoid arthritis over time, so doctors are watching for early signs. New studies suggest that low-dose biologic medicines, like TNF inhibitors, may help some patients who have frequent attacks despite standard therapy. Researchers are also exploring genetic profiling to predict who is most likely to progress to chronic arthritis, which could guide early treatment decisions. In simple terms, scientists are trying to find a weather forecast for each patient to decide how fast to bring out the umbrella.